ವೀಕ್ಷಕರೇ, ವಿರಾಮದ ನಂತರ ನಮ್ಮ ಕಾರ್ಯಕ್ರಮಕ್ಕೆ ಸ್ವಾಗತ. ಇಂದಿನ ವಿಷಯ ಡೊನೇಟ್ ಆರ್ಗನ್ಸ್ and save life. We have two resource persons with us, Dr. Rohan Bonis, and he is a Chief Administrative Officer, Kanachur Institute of Medical Science and Research Center, and Sri Lal Goyal is a Chairman of Organ Donation Foundation, India, and GAN. Both of you are again after the break. Welcome to the show.
Thank you.
We have with us Dr. Vijay Pai. He is a leading ophthalmologist and cornea surgeon, as well as professor, Department of Ophthalmology, K. Segde Institute, Delkatte. Dr. Vijay Pai, are you on the line?
Yes, sir. Very much so.
Good morning. We are very proud to invite you for our show. We have one common question. This eye bank, there are like our Mangalore is a cradle of banking for financial banking. Now eye bank is also there in various medical institutions also. And how it happens, and if a person is dead, how you just what you can harvest that cornea and transplant to live persons. Can you just brief about it?
Yes, sir. A very good morning to you, S. Naik, resource person, my good friend Dr. Rohan, and Mr. Goel.
Thank you.
Well, as you are aware, now eye donation is, in fact, in another week or so, we would be celebrating eye donation fortnight.
Okay.
Starts from the last week of August to extending on to the first week of September, wherein we create awareness among the general population towards eye donation. Now we have, I am associated with K. Segde Charitable Hospital, which has an eye bank. And there are various medical colleges which also have eye banks. And see, the important thing with what I would like the viewers to understand is the problem that we are dealing with. See, there are a lot of myths about eye donation and eye transplantation. I would like the viewers to understand that cornea is a transparent clear structure which covers the front of the eye, much the same as the glass which covers the dial of a watch that we are all wearing. Now, for some reason, if the glass becomes opaque, then the dial of the watch is not visible. Same thing happens to the eye when cornea becomes white from being transparent, which can happen due to variety of reasons, infections or injury and so on. And such an individual loses his sight. Now, we need to understand the magnitude of the problem. There are about 12 million people in India who are blind because of corneal issues, and of these 2 million are blind in both the eyes. Now, good news is that we can make these people see by way of corneal transplantation. So, at present, all over India, we are performing about 30,000 transplant surgeries every year, which I feel is highly inadequate. Now, here I would appeal to all the viewers to donate their eyes. All you have to do is walk into any of the eye banks which is close to you and fill up a pledge form. You will be given what we call as the donor card. And in the unfortunate event of your death, the next of the kin needs to inform the eye bank. We have personnel working in the eye bank 24/7 who will come and harvest the eye. And I must emphasize here, this will not cause any kind of disfigurement. While we do so, the cornea is then stored and evaluated at the eye bank and then is utilized for transplant purposes. I would also like to emphasize the fact that anybody can donate their eyes. It does not matter if he has diabetes or hypertension, age, caste, creed, nothing really matters.
Okay.
So, I think all of you would have seen that movie Black. I think it's a popular Hollywood movie wherein you have Amitabh Bachchan and Rani Mukherjee who plays the role of a blind girl.
Correct.
It's really a beautiful movie.
Correct. Better we can see that movie so that we will get more energized now.
Very true, very true, very true.
Now, you are doing lot of awareness campaigns, no, in various places, especially.
Yes, we are conducting talks and we are trying to educate people regarding awareness for eye donation. There are so many myths on eye donation. Some communities think that if you donate their eyes, they will be born blind in the next birth, or maybe they will not be able to see what is really happening to them in heaven, and so on and so forth. But I don't believe any of that would be true, and I would really encourage everyone to donate their eyes.
If any person is dead, within how many hours it will be effective that harvesting should take place?
What I suggest to the viewers is that ideally we need to harvest the eye within 6 hours. Unfortunate event of death, what I suggest the viewers to do is keep an ice pack on the eye, so that the cornea, the quality of the tissue is maintained.
Okay.
And ideally within 6 hours we need to harvest the eye, and we will come to the place, hospital or home, wherever the unfortunate event has occurred, and we will harvest the cornea without causing any disfigurement to the face or as such to the area around the eye as well.
Okay, that means it should not be dry, should be little bit, that should be
moist.
Yeah, many times after that the eye is not totally closed.
Okay.
So that the cornea now gets exposed to the outside environment and becomes, and the tissue gets degraded. The corneal, the surface layer gets eroded off. We don't want that to happen. So I would request the viewers, in case if they are planning to donate the eyes of next of their kin or kith, so what you need to do is close the eye and keep a small towel over it, wet towel if nothing else is available, or still better if you have some ice, you can tie some ice in that cloth and keep it on the eye. So that will make sure that the cornea remains intact for a fair period of time.
Okay, excellent.
Can I also ask a question?
Yeah. One question our guest wants to ask you.
Doctor, good morning to you. I just want
Very good morning, sir.
I just want to ask you one question. In Sri Lanka, the eye donations are taking far more than any in India, percentage wise. Can you just explain why? What is the reason for that?
I think it is just a community awareness. Sri Lanka is a community. In fact, to be honest, we used to get eyes from Sri Lanka. Say about 10-15 years back, 10 years back, we used to get a lot of eyes from Sri Lanka. We used to get here as well. We have used a lot of their corneas as well. I think it is something to do with the community awareness. Like even in India, you have this Jain community and Gujaratis who donate their eyes a lot. I think in every family you will find somebody or the other being the eye donor. It has got something to do with the awareness within the community itself, which is what we are trying to inculcate among the people. So you increase more awareness. People have a lot of myths about eye donation, and I suppose over a period of time now we have the awareness about eye donation has increased to a reasonable extent. We are getting a lot of eye donation calls, but for whatever said and done, many times the quantity of the tissues that we get is not really sufficient to meet the backlog. At any moment of time, I suppose any eye bank or any institution will have at least some 150 patients waiting in the waiting list. So we don't get that many tissues to take care of so many patients.
Doctor, is there any upper age limit for the eye donation?
No, there is no upper age limit for eye donation. You can take the tissue from any age individual.
And it can be transplant, or it will be
Yeah,
used for
it
the
can
research?
be, the tissue will be assessed at the eye bank. If the tissue is not used for corneal transplant, see, there are various kinds of corneal transplantation. Now, the newer thing in corneal transplantation is that you don't actually have to transplant the entire thickness of the tissue. You can take a layer of the tissue and transplant that layer. So depending upon the quality of the tissue, all the tissues can be used in some way or the other.
Thank you, Dr. Vijay Pai, for enlightening our audience as well as giving light to various patients and giving light in our program also. Thank you very much. We invite you for our separate show on your topic also. Thank you very much for enlightening us.
Thank you, sir. The pleasure and honor is all mine.
Thank you, thank you, thank you.
Thank you.
Thank you. Excellent. Dr. Vijay Pai is a leading ophthalmologist as well as cornea surgeon also.
Yeah.
And he is a professor in Kshema also. We are very proud that such distinguished doctors are in our district also. We are very proud of him. Okay. Now, procedure how to donate organs, because all things we have told. Now, after seeing our show, many people might have decided. What is the procedure? What they have to do? Can you just brief?
Yeah, see NOTO, as you have already mentioned about NOTO. NOTO, one can go on a NOTO site, which is NOTO, NOTTO .gov